Hey, it's Jessica DaMassa with WTF Health, and joining me right now I have Pesce. He is the co-founder of SoberGrid, and this is an app that is disrupting the addiction recovery space. So there is a lot of attention being paid in this space right now. Opioid epidemic, there's a lot of big government agencies, a lot of big foundations that are focused on solving this problem. And I understand that here at Health 2.0, you guys have won the Robert Wood Johnson Foundation
really
challenge
excited.
for that.
Yep,
yeah, so congratulations on that.
Thank you very much.
It's fabulous to have you here. So talk to me a little bit about your app and what it does.
Sure. So we built SoberGrid to enable people to connect 24/7 for support, both to achieve sobriety and recovery from drug and alcohol addiction, and as importantly, to maintain that recovery. Right now, what's happening, you mentioned that there's a lot of focus being put on expanding access to treatment. The challenge is what happens after treatment. Right? 30 days in a treatment center or even just a detox doesn't fix the problem. You need to give people the tools they need to manage their condition and live happy, healthy lives.
For the long term. I mean, that's
Exactly.
the thing that I think is really interesting about your app is that it's really looking at that after the post 30-day mark and into forever,
Yeah.
right? So tell me about how it works. Like what is the general principle of it?
Sure. So we kind of took the knowledge that programs like Alcoholics Anonymous, Narcotics Anonymous are very effective for many people, but that there were barriers to accessing those kinds of support where and when people need it. So we took that into the digital age via an app and just created this community that's rapidly growing. We have over 135,000 members using the app so far, supporting one another 24/7. And as we've grown, we've then begun to layer in evidence-based features. So things like what's called contingency management, different motivations to help, guide people to maintain a program of recovery.
Is it like a chat system? Like what is this that people are actually doing? Like if I am somebody who is in recovery, what is my on-app experience?
Right. So we wanted it to be intuitive and kind of familiar, as with other social apps that people use. So there's a news feed, there's geolocation where you can find and connect with others around you, there's chat, there's a burning desire functionality, which is really important.
What does that mean?
So that is kind of borrowing the terminology from AA. When somebody's struggling, the phone often weighs 1,000,000 pounds. It's very difficult to reach out and ask for help. So we created a feature where somebody can put out an alert, let the community know, let people around them know that they're struggling, and receive that support incoming. And it works because really many of the folks who are on our application are on there to support others. So there are people on SoberGrid who want to help. In addition to that, we recently began delivering certified and trained peer recovery coaching.
Okay.
So taking that lay support to the next level.
Okay, so talk to me about some of the outcomes that you're seeing here real quick. So, I mean, 'cause I would imagine that not only even for somebody who's, pressing that panic button and getting the support they need, like that's great, but also on the other side of that, I'm curious, what kinds of other benefits are you seeing from people who are providing that peer-to-peer support?
Right. Well, actually, people, and this is just tremendous amount of anecdotal evidence that we have.
Right.
People tell us that by providing support to others, that's how they maintain their own program of recovery. It really solidifies that for them. So that's kind of what drives that. In addition to that, as far as evidence, we have conducted a study that shows an increase in treatment completion for using our peer coaching.
Okay.
In addition to that, we have a tremendous amount of anecdotal evidence from members telling us the support they received from others kept them from relapsing.
Great.
When we're talking about opioids, heroin, that's quite literally a matter of life and death.
That's incredible.
So, moving forward, we're working with our research partners at some leading institutions to gather concrete evidence.
Okay, so you're looking for more like clinically based.
Correct.
Okay, great. Okay, and how far are you away from that? Excuse me.
So we've received funding from the National Institute of Health and the National Science Foundation, and we've completed what's called Phase 1 grants. We've applied for Phase 2 funding, which will include a randomized controlled trial,
Okay.
and that's probably on the next year horizon.
Okay,
Yeah.
and then what's your ultimate aim here? Are you seeking like an FDA approval on something like this, or?
No, not currently. What we're doing doesn't really require that, but our ultimate aim is to lower relapse rates within the population at large, improve outcomes, and we believe the best way to do that is to continue to work with county mental health boards with our peer recovery coaching, and also to begin conversations with payers to work with their populations.
Okay, now what's your business model behind this? Who's your customer?
So currently our customer are these county mental health boards who
Okay.
can purchase recovery coaching for their constituents.
Great. Okay. And is that the model moving forward, or like you said, you're trying to work into more of a provider community and a payer community?
So, well,
More-
both. So for the time being, it's to continue to sell to counties and county mental health boards. We're looking to expand within Ohio and also Massachusetts, and then we've begun conversations with payers as well.
That's fantastic. Very exciting stuff. I'm really excited about the grassroots approach to taking on this huge challenge of
Absolutely.
looking at this space. Thank you very much for weighing in on us. And if somebody wants to find the app, can they find it in the App Store yet, or are you where
Yes.
are you
Yeah.
at?
No, we launched in 2015.
Oh,
We have
wow,
a
you've been
community
around.
of 135,000 people using the app, free to download in either the Apple App Store or the Google Play Store.
Awesome. Chris, thanks so much for joining us. It's a
Thanks so
pleasure
much
to
for
speak with
having
you.
me.
I'm Jessica DaMassa at Health 2.0 for WTF Health.